I would say the most difficult part of the last year has just been the volume of patients we've had to deal with. Obviously, dealing with huge numbers of patients with a disease that didn't previously exist in a system that didn't have a lot of extra capacity was a major challenge. The fact that it's gone on for this long and the endurance required to get through it, and also the shifting grounds that we've been on. You know, the way we treat patients has constantly been evolving. The right thing to do, the best way of taking care of them has been constantly evolving. And you have to evolve with it at the same pace because you never want to be behind when you're taking care of patients who are critically ill and their lives are on the line. When we see people protesting against the restrictions, it's incredibly frustrating because the healthcare team has been working nonstop. Our sleeves have been rolled up. We've been working longer than normal shifts and more shifts than normal. We've had our vacations canceled. And we've done that to take care of a huge number of critically ill patients. And then there are people out there who are saying, you know, I've been inconvenienced because I can't go to my favorite restaurant. I've been inconvenienced because I can't go to my gym. And I don't see the reason for that. And the reason for that is that the healthcare system has a finite amount of resources. And when we exceed those resources, more people die. So the only way to make sure that we limit the number of deaths, and we've already had over 10,000 deaths, the only way to limit the number of deaths is to make sure that we have less transmission. And the only way to do that is by public health measures. Now we have an additional resource. We have vaccination. So when people get vaccinated, that's the way to open things back up again. With our vaccination numbers continuing to go up, I think we can see the light at the end of the tunnel finally. I don't think COVID goes away even when our vaccination numbers go up. It'll become what we call an endemic disease instead of an epidemic disease. We're going to still have a trickle of patients with COVID, but at least it won't be at a level where the healthcare system is at risk of being overwhelmed by that. We should still be opening up cautiously. Just because something became legal yesterday doesn't mean that we all have to do it today. We have to see how things go because we're going to open up and then we're going to probably have some missteps and we're probably going to have to make some adjustments and maybe close some things down again. But if we do them safely, then we won't have those missteps and those closing back down again. And we also have to keep in mind that when the healthcare resources get as overwhelmed as they did in Ontario and to a certain extent Alberta, the more patients we have and the more overcapacity we are, the more the healthcare system suffers and the more the people being treated by that healthcare system suffer. The more patients that are in the ICU, the higher the rate of death is because A, you have more patients, and B, you have less resources to take care of them. So we did a good job in Quebec in keeping the numbers at a level that was manageable. There were times where it was pretty tight and we were pretty worried, but we managed to get through this. And I hope that we just continue to get through this with either no fourth wave, which would be lovely, or with a fourth wave that's easily handled and doesn't risk overwhelming our capacity so that we can go back to taking care of patients who have other problems. Because one of the things that's happened in the last year is that patients with other diseases, cardiovascular disease, arthritis needing joint replacements, their care has all been put to the side to deal with this overwhelming number of COVID patients. We want to get back to taking care of those patients and make sure they get the care that they need.